this, we need to be certain that young people view the field of science as one of great challenge and great satisfaction. Scientific discovery moves the world forward, often the sum of the work of many. According to the Franklin Institute's website, inventors are ordinary people who think in extraordinary ways. We should be thankful that we live in a society that encourages thinking out of the box. In 2001, I founded a medical clinic in a resource-poor area of Kenya. It evolved to fill a need that I recognized as I came to know and care about the people there. I hired a young physician, Dr. Murithi, a young Kenyan physician, who agreed to sign on with this foreign lady with an idea to go out into the bush and practice medicine in an Airstream trailer. Friends from the United States, most notably Dr. Robert Murphy, agreed to help by teaching Dr. Murithi protocols he had not learned in medical school, particularly in the area of diagnosing and treating HIV/AIDS. Both Dr. Murphy and Dr. Murithi are here with us tonight. We have recruited additional U.S. physicians, several also here tonight, in a variety of disciplines to consult with our Kenyan staff. Once Dr. Murithi got started on his personal quest to expand his medical knowledge for the benefit of our patients, he was unstoppable in his desire to learn. Dr. Murithi represents a point I wish to make. While here in the United States, we have the support of our citizens and our government to encourage and fund scientific investigation and the opportunity to learn and grow, those in developing countries often have no such support. Often, in practice, they do not have the diagnostic tools nor the medications necessary to treat injuries or disease. Our Imberakani Group Clinic, with Dr. Murithi as our chief physician, has grown from the days of the Airstream trailer, which continues to provide outreach service, to a project with more than 140 Kenyan employees and approximately 30,000 patient visits per year. The government hospitals in Kenya have begun referring patients to us, a sign of recognition of the excellence of our medical services. The outcomes of one of our preventative initiatives are nothing less than spectacular. We have a small prenatal program, and when we identify an HIV-positive mother, and she agrees, she is enrolled in our Prevention of Mother-to-Child Transmission program. She is fully treated and educated as to the means by which she can avoid transmitting the HIV virus to her baby, which includes artificial feedings under our strict supervision. As of January 7th of this year, of the 292 babies born of HIV-infected mothers in our program, 100% of those babies are HIV negative. And thank you. And thank you to our doctors. And we've had no gastrointestinal problems with those babies. This in an area where nearly all of the water sources are unfit for human consumption. We are all extraordinarily proud to be able to say that we have prevented each of those 292 babies from starting life with the burden of being HIV infected. I am convinced that people all over the world want to be healthy, and they want their children to be healthy. They simply may not know how to accomplish that. Preventing disease is always more efficient than treating it. Education, vaccines, post-exposure prophylaxis, mosquito nets, pit latrines, condoms, water purification, nutritional supplements, prevention of mother-to-child transmission programs, all can aid in preventing illness. but success requires the diligence of trained medical personnel on the ground and an infrastructure for delivery of services. We can change the world, and we have demonstrated in the most resource-poor setting it is possible to provide individualized, high-quality health care. I remain firm in my advocacy for support of medical research in the United States and of strong public-private partnerships. But I add my voice, buoyed by my hands-on experience, to those already working to increase awareness and expand support of a global initiative for a healthier world. In closing, here's something to ponder. In 1970, I asked my grandmother, who was 85, what discoveries had changed the world most dramatically in her lifetime. She said, the invention of the car. Can you imagine what you will say when you are 85? Thank you again to Research America for all you do to make us healthier and safer. Good night.